my name is Angela, and I'm a nurse practitioner student. I'm going to be performing an ears, eyes, nose, and throat mouth assessment. I'm going to go ahead and be using my husband, Austin, who is a 34-year-old male, and he's graciously agreed to help me. So first up, we're going to test our eyes. I'm going to go ahead and use a modified Snellen chart. It is to be used 6 feet away from the patient. So I'm going to go ahead and stand 6 feet away, and I'm going to have him read the lines for me. Okay, read me the line that is clearest for you.
FEZPDT.
And cover your left eye.
FEZPDT.
And cover your right eye.
FEZPDT.
Okay, and according to this Snellen chart, he read 20-25 line, which means that he is seeing at 20 feet what a normal person would be seeing at 25 feet. Next, I'm going to go ahead and do a confrontation test, which tests peripheral vision. We're both going to cover our opposite eyes. And I'm going to have you tell me when my finger comes into your line of sight.
Now. Now. Now.
And I'm going to have you reverse and do the next eye.
Now. Now. Now.
Okay, and so both of us had that finger come into our peripheral vision at the same time, so it would ultimately be normal. I'm going to go ahead and test your extraocular movement, which tests some cranial nerves 3, 4, and 6. I'm going to have you stare at my finger, and I'm going to have you follow it without moving your head. And his eyes move appropriately with no nystagmus or any sort of extra movement. I'm going to go ahead and inspect his eyes. His eyes, from just looking, are symmetrical. They both appear to be the exact same color of blue. I can see the irises, and they are both circle and regular and round. His eyebrows are symmetrical as well, and they do follow a normal hair pattern for the eyebrows. His eyelashes, both upper and lower, both are facing outward and away from the eye, and they both appear to be of normal pattern. I'm going to have you squeeze your eyes tightly and open them. And he follows those commands as well and allows that to happen. He closes them tightly. There is no space when he does close them. And both eyes open exactly the same, and there's no ptosis with one eyelid drooping. I'm going to go ahead and palpate. I'm palpating your upper eyelids. The lacrimal ducts are not swollen or edematous. I'm not noticing any swelling or edematous or any sort of signs of infection. I'm going to push lightly on your eyes. His orbit, the actual eye itself, pushes in as well as it's supposed to, so there would not be any sort of issues with pressure there. And everything looks good on his eye. I'm going to go ahead and use my pen light. I'm going to assess for direct and consensual accommodation. So I'm going to have you just look at me, and I'm going to shine a bright light. And I'm going to do the other side. Okay, and both eyes do appear to react the same, brisk, and they're both 3 millimeters. I'm going to go ahead and look at his sclera and his conjunctiva. Have you look straight up? I'm going to pull your eyelids down a little bit. And his conjunctiva does appear to be translucent pink because of the vasculature, and his sclera is white like it should be. One more time with the pen light, I am going to test for a reflex, make sure that I can see the reflection both symmetrically in both of his eyes at the same time. So I'm going to have you look straight ahead. And both of his pupils do react to the pen light at the same time. I'm going to have you follow my finger. And his eyes do converge like they should as something gets closer. I'm going to go ahead and use my otoscope to look inside of his eye. I'm going to do the right eye with my right hand and my right eye. I'm going to go ahead and stand a foot away, and I'm going to be looking for the red reflex. And I do see that in both eyes. Okay, now I'm going to move in closer, and I'm going to be looking for the optic disc and the blood supply. I'm going to have you stare straight back over there, over my shoulder, and I'm going to be looking at your eye. If you need any breaks, just let me know. And I do see the blood vessels. They are moving away from the optic disc, which is a yellow colored area. I do not notice any sort of narrowing or anything in the vessels with the eye, and I would then repeat that also with the right eye. Next, I'm going to go ahead and inspect his ears. Switch out this otoscope. Okay. First thing that I'm going to do is going to be looking for symmetry. Both ears are about the same. I'm looking at his inner canthus and looking out with an imaginary line, and they do appear to be positioned correctly. They are not too low. His ears do appear to have no drainage. There is no extra growths. I'm going to go ahead and palpate for tenderness or masses. And does anything feel tender? Everything feels okay. Throughout this entire assessment, I have been talking. He's been responding, so I know that he can hear me when I'm talking of a normal voice. I am going to go ahead and do a Weber and Rhine test with the tuning fork. I'm going to have you go ahead and let me know when I place this on your head if you hear the sound in both of your ears the same or if it's different in one or the other.
Same.
Okay. And now next I am going to do the Rhine test. I'm going to go ahead and place this on the back of your ear. I'd like you to tell me when you do not hear it any longer, and I'm going to move it to the front of your ear, and then you'll tell me when you don't hear it.
Now. Now.
Okay. And I'm going to repeat it on the other side.
Now. Now.
Okay, and both were approximately, the bone conduction was 3 seconds and the air conduction was 6 seconds, which is appropriate. Air conduction should be twice as long as the bone conduction. I am going to go ahead and use my otoscope, and I'm going to go ahead and look at his auditory canal as well as his tympanic membrane. I'm pulling the pinna up and back because he is an adult. I'm going to go ahead and gently insert it in the ear, and I'm going to go ahead and take a look. I do see some mild cerumen, but nothing blocking the auditory canal. And I do go ahead and see his tympanic membrane. It is pearly and gray. It doesn't appear to have any sort of fluid back there and perforations. It looks pretty healthy. I would also, again, repeat that in his other ear, the right ear, if this was appropriate. Next, I'm going to go ahead and test his nose and sinuses. The first thing that I'm going to do is inspect its shape and size, as well as symmetry and color. It's obviously appropriately colored for his ethnicity. It does have the appropriate shape and size. Unfortunately, it is a little asymmetrical. It is facing a little bit to his right due to a prior injury and a potential deviated septum. I'm going to go ahead and palpate for masses or any sort of tenderness. Let me know if this is hurting.
Nope.
Okay, and that feels okay. I'm going to go ahead and look at the patency, or test the patency. I'm going to close one of your nostrils. I want you to breathe through the other one. And perfect. I'm going to go ahead and use my otoscope to go ahead and look up in the nose as well. It might be a little bit uncomfortable, but bear with me here. I'm going to have you tilt back just a little bit. And I am looking up into the nose. And I do not see any sort of drainage. I see just hair, and it is pink. I'm going to go ahead and look in the other side. The same thing, no drainage. Unfortunately, the right side is a little bit more narrow just due to the asymmetry. I'm going to go ahead now and palpate your sinuses. Please let me know if this is tender. Doing the frontal sinuses. And I'm going to do the maxillary sinuses. Any tenderness?
Nope.
Okay. Now I'm going to go ahead and inspect his mouth. The first thing I'm doing is, again, just looking for any sort of signs of infection, any sort of irregularities. And his mouth looks up to be symmetrical. He has facial hair. It's all well groomed. I'm going to have you go ahead and smile for me. And I'm going to have you clench your teeth. Perfect. I'm going to have you open your mouth. I'm going to go ahead and look inside at your teeth. And I do not notice any sort of issues with his teeth. He has all of his teeth, and there's seems to be okay dentition. I'm going to go ahead and look at your gingiva. Everything looks pink. Inside, everything looks very moist and pink like the mucosal area should be. His hard palate looks intact and everything looks good. I'm going to have you stick out your tongue for me and move it side to side. Perfect. And it doesn't appear to have any sort of ulcerations, and it is the appropriate color. I'm going to go ahead again, have you open your mouth for me one more time. Now have you raise your mouth to the top of your tongue to the top of your mouth, and I'm going to try and look at your frenulum. Put your tongue all the way up. Okay, and due to some prior frenulum surgery, he is unable to do so. That would be an abnormal finding. I'm going to have you go ahead and stick your tongue out and say ah, so I can view the uvula and the tonsils.
Ah.
And his tonsils appear to be +1 normal in location, and his uvula does veer a little bit to the right when he says ah. And I guess that is everything that I need for this assessment, so thank you for watching.